Hey, it's Tuesday, and we're going to be discussing a specific topic for Topic Tuesday. And today's topic is going to be blood pressure. The American Heart Association and the American College of Cardiology came out with new guidelines for blood pressure. That new number is 130/80. And what does that mean for the average American? Well, stay tuned. In this segment, I'm going to be discussing what that means for the average American and what you can do to reduce your risk of high blood pressure. Welcome, and thank you for watching Prescription Nurse, your daily dose to living well. I'm Chandra Eldridge, your nurse consultant, and today's topic is hypertension or high blood pressure for Topic Tuesday. Last week, the American Heart Association and the American College of Cardiology came out with a new guideline for hypertension or high blood pressure. That new number is 130/80, and I just want to talk about what that means for the average American. Now, don't be alarmed and think, oh God, I got high blood pressure, I got to go out and get on medication. But what it means is if you already have high blood pressure or if you've already been diagnosed with high blood pressure, it just means that you want to keep your appointments with your physician, manage your medications and stay on your medications, and make lifestyle changes. And if you are at risk or you're borderline, you're almost there to having hypertension, you want to modify some lifestyle changes. But they all kind of go hand in hand. And some of the lifestyle changes that you can do is, first, go see your physician. Keep your appointments. Don't go years and years and years without seeing a physician and without knowing your numbers. It's very important to know your baseline. Where do you stand? Are you 140/90, or are you 130/80, or are you 170/100? Know your baseline. And when you find out your baseline and you are prescribed medications, make sure you take your medications as prescribed and don't try to self-diagnose and self-medicate. I know that may be hard, but that's very important. And the second thing you want to do is look at your lifestyle. So being at risk means that you are obese, that you live a sedentary life, and that you already been diagnosed with high blood pressure. So you want to get some exercise into your daily routine, whether it's taking a brisk walk, doing some jumping jacks, but you want to make sure that you're exercising. You want to make sure that you're doing something that's challenging the body, because remember, if it doesn't challenge you, it won't change you. So if you're not exerting enough force to challenge the heart and the heart vessels, then it won't change to make them stronger. So you got to do some type of physical activity that's going to make you stronger and that's going to challenge you. And the next thing you want to do is look at your diet. If you have a poor diet, it's going to put you at a higher risk of getting high blood pressure or hypertension. You want to make sure that you're not having a diet that's high in sodium. You want to add those fresh fruits and vegetables, because that's going to help manage your blood pressure, keep it at a normal level, and also your cholesterol. And then another thing you want to do is manage your stress. Find ways to keep your stress in check, because stress will kill you. And having high blood pressure has been known as a silent killer, and a lot of people don't realize that they have high blood pressure because the blood pressure spikes in stressful situations, but then when that situation's over, it kind of goes back to being normal. But if you're always stressed out and you just think I'm stressed, but you never really think about how that's affecting your blood pressure, then you may not go get it checked. So you want to make sure you're managing your stress. So those are just 3 little lifestyle changes that you can do. Exercise, make sure that you have a good diet, lots of fresh fruits and vegetables, drink the necessary water, make sure you get some exercise, make sure you manage your stress, whether you have to do some meditation, go on a vacation, or take one day just to do some journaling, or anything that's going to help you to relax. Have a spa day. But those are some things that you can do in your lifestyle that will help you to manage your blood pressure. So what I want you to take away from this video is don't panic. You want to go to your physician, get a baseline, and go from there. But if you exercise, eat right, manage your stress, then your risk for having hypertension will go down. So if you like this video and you found it to have some value, or you find it to have value, hit the like button and share. Stay tuned to Prescription Nurse. Now that's your daily dose.